I now can say, and I'd be willing to debate anyone, anywhere about this, that it's one of the most vital investments a person can make to protect themselves financially, because you can see already what's happening in all those trends. There's no sign that they're slowing down. People are paying more and more out of pocket for their health care. When we get to where we're retired, let alone our children, if you have diabetes, heart disease, if you've got cancer, you're going to be paying for a huge amount of that bill yourself. And that means that you're not going to be having a second home in Florida or traveling a lot and stuff. Your excess income beyond the essentials is going to be to pay for your health care, unless you've stayed out of that. And the beauty of it is, if you make that investment, you get to enjoy great health all your life and avoid that scenario. And that's money that you're putting away, in a sense, that's completely tax-free by investing in yourself and in your care. An investment, too, that's important for not just you, but for every person that loves and depends on you. So even from a cost standpoint, if you do the analysis, we've had patients who've tried, because of their financial situation, to go and have come back and said, first of all, I couldn't even go to that many doctors because no one would do this that you do, or this person says I got to go here and do that, and then trying to figure that out, and I just no way I could get off work that much. And I started realizing all the different co-pays and things I'm paying anyway. Why am I doing this when I can get comprehensive care all at the same place by an expert? So the good news is that yes, invest in your health. There is considerable expense to that, but it certainly isn't out of line with anything else we put money in. When you think about what we spend on luxuries and entertainment, etc., I think it would make sense that we would invest at least as much in our health. But again, the good news is that I believe that excellent care in the long run is actually less expensive for you than the kind of care that you don't even like and enjoy and don't even feel like it's good quality care, like it's medicine. We're excited about the fact that we're creating a model, both for patients and physicians, where you know that you can use all of your brain, all of your training, and all of your intelligence on the person in front of you to help them understand what's going on with them and to help them meet their goals. And that's really, really exciting. Without enough time, there's no way I can connect my intelligence. It doesn't matter how much training I have. If I don't have enough time to listen to you and to think through what's going on with you, there's no way to understand even generally what's wrong with a patient, let alone to individualize those decisions to that particular person.
The treatment model here at DTRC is one of a kind. It is not something you will find anywhere else. Dr. DeWester will actually spend that quality time with the patients. He is not one of those doctors that's sitting on their computer and not actually paying attention to the patients. Like, he is actually engaging and speaking with the patient, figuring out exactly what is going on. He's digging deep into their medical history to find out all of their past problems and really create a nice customized treatment plan with the patient. That, I'm telling you, you will not find anywhere else.
There's been this idea for a long time, and people thought we did aesthetics anyway, because people, when they got healthier, their shape, and women would go back to this and men like this, and we act like there's some kind of conflict between aesthetics and health. In fact, the one goes with the other. We're attracted to those shapes because they convey health. And so it was kind of a natural step, but it's wonderful for the patient because we're doing all those things, and we're going to continue to add until we have virtually probably almost all of those kinds of services as well that are out there and reputable and available for patients, but still within the context of the kind of care they're used to, where we're still their advocate. We're not going to sell them things that don't make sense for them. We're not going to tell them that there's procedures or treatments that can do things that in fact that's never been proven. We will still be their advocate, even in aesthetics. So adding that division now with everything else we do is pretty exciting. It kind of completes the package for us. And certainly there's things we're going to continue to add as we add providers that are able to do those services. But we're excited about the future and about continuing to grow this model in the direction it's going.
Hi, my name is Susan Barnes. I work here at Dr. DeWester's office, and I get asked a lot why I decided to join Dr. DeWester's team. And it's an easy answer for me. Once I found out what his philosophy was about treating the patient as a whole and looking at all the different aspects of their health and how they all tie in together, that was what did it for me, because been in the industry a long time, for 20 years, and I've always felt, like I always knew deep down that there were other issues that played in to how someone's skin responds to a tightening device, or how they're going to respond, to body sculpting devices. And it bothered me that I would do these treatments and I'd have one person respond really well. I'd have another person who wouldn't respond, very well at all. And I was like, there's so much more into this. And I knew hormones was a huge part of it. And so it really bothered me that I didn't have any way else to help them. I could say, hey, have you gotten your hormones checked? And they'd be like, yeah, I got them checked a couple, months ago and everything was fine. And I'm thinking, no, you should be responding a lot better to this treatment. So I felt kind of like I was taking their money. I just love the philosophy that Dr. DeWester has of looking at the whole picture. And, if someone wants to come see me, and I can ask them all of those questions. And if I feel like, you know what, maybe you should go see Dr. DeWester first, because then anything I do on the aesthetic side, you're just going to respond so much better, get way better results. That I feel good that once they've seen him and they come to see me, that we're going to get the optimal results that we can from these devices. So that was a huge part of why I came to work here. And I'm really excited to grow the aesthetics department and just help people feel better about themselves and get them on the right path to becoming much healthier and gaining more confidence and overall, optimizing their results and having a better life because of it. So that's why I do what I do. That's why I decided to come join him.
We attack all of those areas, from body comp to mental health to lifestyle, to relationships, and to chemistry and hormones, physiology. That by looking at that whole picture and addressing those things within the patient's goals, that we're going to get the best results overall anyway, but also because we're doing that, we're much more apt to get results, at least in something, quickly, that helps the patient, because it isn't easy to make changes. Too often when I was in training, that when patients didn't comply and didn't continue in therapy, it was always assumed like, well, that's their problem, instead of looking at why is that. When in point of fact, if we look at our own behavior, we know that almost nobody is going to continue something very long where they don't, especially things that are painful and difficult, where they don't receive results. In this case, when you're addressing all of these areas that are applicable to their problems, the likelihood that you're going to get something moving is great. And then it keeps the patient going, and those improvements motivate them to continue. And of course, as that process continues, it's like synergy. It just builds and builds and builds. You get patients beyond a certain point, you don't need to worry about it, because they're so excited, they're so invested in what's happened to them, they're going to continue the process. So we're very excited about that. And again, there was no way to pursue that kind of care in the conventional setting now, and not because doctors and nurses don't want to do it. It's because the payers are paying for basically about 8 to 10 minutes with you. There's no way to do this. I call it paradigm medicine. That is, there's no way to get off the flow chart and think independently and creatively with this particular patient. We talk about individualized care. We understand that it makes sense from our science that care needs to be individualized, but we don't have the mechanics to pull it off. And again, it frustrates doctors and patients all over the country.
So it's very common for patients to see maybe 5 different doctors, one for their blood pressure, one for their weight, one for their thyroid. But what's something that's unique and cool about this treatment model is you can typically see one doctor to treat all those vast areas. With that said, obviously, if you do need to be seen by a specialist for something, we will obviously refer you. But it's so nice to know that you can have one doctor handle all those issues.
I mean, in the conventional setting now, I mean, I can go to someone on the internet for my hair, or I guess even my ED. I can go to my primary care doctor for some of my preventative routine screenings and stuff. I can go to a med spa, to get some cosmetic stuff done. I can go to a bariatric center for aggressive weight loss. I can go to my psychiatrist for my depression and anxiety disorders. I could, and it doesn't even stop there. There's other things. Or I can come here and get that all from the same person in an integrated package. That's one of the most fundamental differences. And I didn't even exhaust the options of the different things that people, if they come to see us, and people say, well, how many people do that? In fact, most of our patients, once they're here and once we go over all of their needs and the things that we would need to address if they want to optimize their health and reach their goals long term, involves a multiplicity of things, where now at a conventional setting you'd be going to all kinds of other physicians to get, and I didn't even mention a hormone center on top of that. So to be able to get that all at one place with the same people who are taking care of all those things in an integrated package, based on the concepts we were taught, it clearly is superior. You're going to have better results this way, but also, who could afford to do the other? I mean, unless you just like coming by and seeing us medical people because we're just that neat to interact with. I don't think that's how most of you view it. But otherwise, I think it's an easy decision about which way you want to go.